Welcome back to the How We Really Feel podcast. I'm your host, Dr. Sula Windgassen, and this is one of my reflective episodes in between the episodes that I have with guests. And this time I'm reflecting on the amazing conversation that I had with Lorraine Grover and Kate Moyle in the episode The Dark Place Between My Legs. This was all about sex, intimacy, illness, what happens when your sex life changes because your body changes or your health changes. And I found this to be such a beautiful episode. It stayed with me for so long. I was talking about it. I still talk about it. It was actually the first podcast episode that we recorded here in the studio. And it was just so full of hope, insight, lightheartedness. And I think that really helps when we're talking about these very difficult subjects. Both Lorraine and Kate were rays of sunshine and had so much knowledge to impart. And it was a real pleasure to have this conversation. So I'm looking forward to reflecting on it with you now. Perhaps I'll start with this concept that both Kate and Lorraine came back to, which was around recovery and discovery. So they used this phrase and they talked about it in terms of when things change, when you get ill or you realize that things have changed in your relationship for a long time, there's an initial focus on the recovering, trying to get back what you need to get back. And if you're ill, if you're experiencing health issues or some kind of physical disruption, that's often very much focused around the physical recovery, trying to help things become less symptomatic, trying to mitigate the role of symptoms, trying to get your health back to some kind of baseline that can sustain you better than it is currently. And what really, I guess, stood out to me, first of all, was the word recovery and the assumption of recovery. I think it was Lorraine that said the assumption of recovery can be, I'm just trying to get back to how it was before. And that can be really difficult when you find yourself somewhere that you just don't understand how things have ended up here. And there's a sense of, because you're here now, it's never going to be as good as it was, or it's never going to get better because things are just so difficult in the here and now. So when Lorraine and Kate talked about this discovery, it was such a light bulb moment for me. And it relates to a concept that I talk about with my clients once they start experiencing it, which is called post-traumatic growth. This idea that once you have worked with the difficulties, processed the impact, the hardships, the things that you have to work around, the challenges, etc., you start to find that on the other side of that, you have discovered more things about yourself. You've opened up things that perhaps you wouldn't have been able to open up had it not been for that experience. And this doesn't mean that necessarily you would choose to have that difficult experience again, but you can still very much appreciate and feel gratitude towards the benefits that you've gotten now that you have been through it. And this was related to that concept of discovery, recovery and discovery. Lorraine said something about when you turn towards what's been impacting your difficulties that you've only become aware of because of, something that you hadn't anticipated necessarily, that might be illness or something else. You might then discover that before wasn't the optimum, actually. Before still had problems and difficulties that are now influencing what you're experiencing. And that's difficult to be confronted by, but it also opens up opportunity to start shifting things, and opportunity to actually have a richer, more considered, pleasurable, in this instance, what we're talking about, sex life than you might have even had before the illness or the difficulty started. And Lorraine shared lots around this, and both her and Kate came back to this concept, which was so joyful and hopeful that it really stood out to me. And it's hard to anticipate what might I discover from this really difficult thing that I'm going through. But what we do know as well from the research, from the health psychology research, is that process of what's called benefit finding and leaning into the lessons, the meaning, the purpose that comes from hardship and adversity is a really protective factor. And it really helps you deal with the adversity, especially when that adversity is so challenging and there's not much benefit to be found. Going deeper in yourself and looking to explore and discover with yourself, who am I in this difficult circumstance and who do I want to be on the other side of this? That can be something that is really, really sustaining when times are tough. So that concept in this conversation felt really important in the context of sex, in the context of relationships and intimacy, but also more broadly speaking, when we're dealing with chronic illnesses, pelvic pain, pelvic health issues, bladder issues, urological issues. And I think, just writing that down, recovery and discovery, and exploring what that means to you in different instances where you're having challenges might actually open up something that's very interesting and inspiring. Another thing that really stood out to me was Kate, and actually she has changed my own language from what she shared. She made this clear distinction between sex and intimacy, which Lorraine ardently supported. They're not the same thing. Often we use intimacy as a word that's a proxy for sex because sex feels taboo. And they both gave examples of whispering the word sex rather than just saying it at your usual volume, because there's this societal taboo about sex and us being able to talk about it. And so intimacy becomes this proxy word, but that can actually end up obscuring the difference between the two. And when she makes that distinction between sex and intimacy, she identifies something really important. And that is that we can have intimacy without sex. Intimacy without sex could be just a kiss on the cheek. It could be intimate kissing. It could be cuddling up on the sofa together. It could be in how you're speaking together. There's so many different ways that we can have intimacy. But if it's so entrenched or coupled with sex, when you're not able to have sex or sex is difficult for whatever reason, and you just equate the two as one, that intimacy can go away. And once that intimacy has gone away, it's much harder for you to have sex. And both Kate and Lorraine talked about this in quite some detail, which was really, really enlightening. And it also relates to this other point that stood out to me from the episode, a point that Lorraine made about your brain being the biggest sexual organ. And she gave this example of a man taking a drug for erectile dysfunctions, so something like Viagra, and then just waiting and then saying, well, nothing happened. It didn't work. And she had to explain that's just the physiology. That just allows, the blood to go where it needs to go, etc. But to get aroused, that involves you, that involves your action, that involves your brain, your desire. And that was so interesting to me, that the two can be so separate in one's mind, that you don't need to involve the brain at all in order to have sexual arousal and enjoy sex. And so that clarity is really important when we're thinking about maintaining a sex life, improving a sex life, and having some kind of adapted sex life around physical illness. One can still get aroused and get some kind of satisfaction without necessarily having penetrative sex if that's not possible, without necessarily having sex the way you used to if that's not possible. But there can still be that arousal, there can still potentially be that pleasure. And with that can come plenty of intimacy. So this link between intimacy and sex, them being related but not the same, and the role of the brain in sexual arousal seems super important, and something that we should be thinking about when we're thinking about, how do we maintain healthy relationships, healthy romantic relationships. The other thing that really stood out from this conversation, thinking about the role of the brain in sex, and all of the things that happen and change in our body when we're getting ready to have sex. The point I think that Kate made, which was the brain will prioritize safety over arousal. So if you don't feel safe for all sorts of different reasons, then it's going to be really hard for your brain to experience that arousal. And then it's going to be nigh on impossible for your body to get aroused and do the things that it needs to do, whether you're working with male genitalia or female genitalia. So this is super important because a lot of the time when people are experiencing pelvic or bladder issues or anything that relates to that sort of area, hence why we called this episode The Dark Place Between My Legs, it automatically makes it feel like that area is not safe, that you're going to do harm, that it's going to be painful, that you're going to create infection, you're going to create complications. This association isn't a big leap for the brain, and it's a very threatening association. So no wonder it feels hard to get aroused or to feel comfortable with sexual intimacy if you're experiencing those things. It doesn't mean it's impossible. It just means that we need to find a way for it to feel safe enough. And that means taking practical and pragmatic steps. That means maybe adapting what you're looking to do sexual intimacy wise. It means trying to find a way for things to actually be safe so that your brain can feel like they're safe, and then things can follow. But if you're just trying to go back to how things were before in a body that's fundamentally different or experiencing things that are different now, then that's only going to perpetuate this sense of threat. And I suppose this leads nicely on to the other element that really stood out to me in this episode. I mean, there were so many different things, but this one was about how automatic it is for us to internalize a sense of faultiness or defectiveness. So if your brain isn't getting aroused, if you aren't feeling aroused, and if your body is not responding like you would hope that it would, and things are clamping down and you don't feel like you can have that sexual intimacy, how quickly your brain interprets that as there's something wrong with you. There's something wrong with you, and it's your fault, and it's shameful, and you should be embarrassed. And of course, just what that does to your brain's ability to get aroused, it adds layer of threat to an already threatening experience. And it naturally makes you want to withdraw and kind of shut that sort of thing out and avoid it, which then only adds even more to this sense of threat and anxiety. So you can see again how this starts to snowball and change things, and gets very difficult to then start to turn towards something that is important for you to turn towards. This is something that we can shift, first of all, by recognizing the narrative, recognizing how harsh the narrative is. One thing that I do with my clients in my practice, and is a common technique in cognitive behavioral therapy and similar sorts of psychotherapies, is getting you to write down the recurrent thought patterns that are coming up for you related to you. And people are often shocked by how negative, harsh, and repetitive thoughts are about yourself. I'm no good, I did that terribly, why does this person even want to be with me? And when you read it written out, you can see just how unfair and harsh and not quite true that is a lot of the time. Sometimes the thoughts are so embedded as beliefs that you really believe them, and it's very upsetting, but it's still very important for you to recognize that that is a belief, or those are beliefs that you're holding, because beliefs aren't knowledge or fact. Beliefs can be changed, and you can be supported to start shifting those beliefs. One thing's for sure, if those beliefs go on, if you keep feeling like you're not deserving, that you're the faulty one, that shame is going to drown you out. It's going to make anything that you try to do to shift things even more difficult. It's going to make it even more threatening for you to not get it right. And then that's going to inhibit you trying new things out. So we really want to shift those beliefs. It's not an easy thing to do, but there's lots of different things that we can do to start to work with it, and be curious, gentle, gradual in our approach to do so. I suppose the last point that I will reflect on from this episode is the recognition of how uncomfortable a lot of healthcare professionals and physicians are when talking about sex. Lorraine gave that wonderful story of being given a consent form about potential for sexual dysfunction after a procedure that she was having, and signing the consent form. And then when she came around being asked how she was doing, and she reported that she could feel her legs and she could feel her clitoris. And she said that everybody in the room didn't know where to look. But this really reflects just how uncomfortable we can be as humans, more broadly speaking, but especially within the medical field, it can be to talk about these sorts of things. And one thing is for sure, if you feel uncomfortable as a medical professional bringing it up or talking about it, your patient is much less likely to bring it up or feel comfortable to talk about it. And it might be something that's really important to that person. Likely it is, because sex is a very connecting thing and very important to a lot of people. So it means that they have to figure that out on their own or assume that there's nothing that they should do. Kate gave an incredibly moving example of women that she's worked with breast cancer who've survived breast cancer, and they feel guilty because their sex life is now changed and different, and they feel like they should just be grateful for being alive and they shouldn't ask for anything more. So the role that the healthcare provider has in helping people to get back to having a healthy sex life, to feeling connected again, is potentially huge. And that doesn't mean that the healthcare professional has to be an expert in sexology or give any of the great advice that Lorraine and Kate gave. It just means opening up the question, giving permission just by asking a question is huge, and then having some signposting resources to send to the patient to explore themselves. So I'm going to end with two little invitations. One invitation is curiosity. Curiosity about what you might discover about your own assumptions about sex and or intimacy. What you think is necessary to have a good sex life, what you think a good sex life is, and how that might be impacting your experience of sex and intimacy. You might explore, are there assumptions or beliefs about sex and intimacy that now have to change because your reality has changed, because your body's changed, because what you physically feel has changed? And what direction might you want to shift those in to make sure that you can still get some sense of pleasure and enjoyment when it comes to sex and when it comes to intimacy? My second invitation is exploring a broader scope for increasing intimacy. What is it that makes you feel a sense of intimacy and connection? If we are making this distinction between sex and intimacy, what are the sorts of things that make you feel intimate? What are the sorts of things that you can do to increase that sense of intimacy? What are the things you can do? What are the things that your partner can do? How much do you do those things? How much do you prioritize those things? And just exploring what this looks like for you and all of these questions and seeing, is there scope for you to make some changes there too? You might consider, what sorts of things could you do for intimacy and connection that would help increase your sense of safety, that would nourish your most important sexual organ, your brain? I hope you enjoyed this Reflectors episode. If you haven't yet listened to the episode with Kate and Lorraine, you can do so now. The link will be in the show notes. Take care.
If this resonated with you and you wish this knowledge was more common and embedded in care, please consider rating and reviewing this podcast so that we can spread the message and improve care. This conversation connects closely with the work I'm doing with Confident Continence Care and their Me Plus programme, which supports people using intermittent catheters with both practical guidance and emotional wellbeing resources. If this is of interest to you and you'd like to find out more, visit convatec.com and access the Continence Care Me Plus resources. Links can be found in the episode description.